What is OCD or Obsessive Compulsive Disorder? OCD is a disorder which patients have unwanted thought, fear, or obsession that cause them to do repetitive actions. Even they try to ignore the obsession, it only increases their stress and anxiety. Thus, they just repeat the action to reduce the stress. This cycle repeats from time to time and can be critical. OCD usually starts during teen or young adult, but it can also start in a childhood. OCD patients usually have similar patterns, such as they are fear of touching objects that others have touched to avoid contamination. They doubt if they have locked the door or turned off the stove, thus they always check multiple times. Then they will become intensely stressed if the object not in order of a certain way. Then they cannot drive into crowded because they are afraid they will harm others. They thought about shouting and acting inappropriately in public. So what is the warning sign to OCD patient? First, they are not able to change their routine even it is needed. Then, they keep repeat doing same things, so for example, organize their clothes or wash their hands. Next, there are excessive fear and doubt and have taboo thoughts that come frequently. There are certain ways for the doctors to diagnose OCD patient. First, they will have psychological evaluation, which is they will discuss about your thought, feelings, symptoms, and behavior pattern to determine the severity of the disorder. Then, they will use OCD diagnostic criteria to determine if you have OCD or not. Then, the last one is the physical examination, which is they will rule out other problems that trigger the symptom and to identify any complication related.
Next, how to take care of OCD person. There are 3 do's and 1 don't. 3 do's: be grateful, be open, and be patient. Be grateful by let them know that you are honored to have gained their trust, by reassuring that you understand how hard it may be to open up. Second, be open. Discuss their obsession or compulsion can be intimidating and make them feel more vulnerable. Lastly, be patient. Patience is a virtue and it will one that is specially appreciated by someone with OCD if they feel like you are respecting their struggles. And last but not least, don't judge. If you react with shock or even a hint of judgment, it will be harder for them to be open up to you and others in the future.
How to treat OCD effectively? OCD is considered a chronic disorder, meaning it is a lifelong and people with OCD will likely experience some symptoms forever. However, this does not mean OCD is untreatable. There are many effective ways to treat OCD that will improve the quality of life for the person affected. The symptoms may not go away entirely, but the person with OCD typically ends up feeling more control and stability throughout their everyday life. OCD is constantly undergoing testing and new treatment methods are discovered every few years. But there are some treatment methods that tend to be the most effective for those who suffer from OCD. Number 1. Find out your triggers. A very helpful way to treat OCD is to realize what your triggers are. Although OCD can be a constant flow of obsessive thoughts throughout the entire day, you're likely to have some triggers, whether you realize them or not. Sometimes, OCD symptoms are triggered by the fear of losing the loved one, or they are triggered by fears of getting sick. For some, a lack of sleep can significantly trigger their OCD symptoms the following day. No matter how great the day is or how safe the OCD sufferer feels, they can still struggle with an increase in symptoms because they are simply sleep derived. When you start to understand your triggers that can cause a compulsion, you can help to manage your symptoms. You can learn to prepare yourself for the trigger of an OCD compulsion and prepare yourself to go against what your brain is telling you. Then, you can generate healthy coping mechanisms such as taking deep breaths or going for a walk. It can also make your OCD seem more understandable rather than leaving you feeling as if you are crazy. Number 2. Understand your OCD. Understanding OCD can be incredibly helpful for those who are struggling with the disorder. Knowing what is going on in your brain to cause you to think the way you do can help you to heal. There are many books about OCD that explain what is going on inside the brain when someone feels the need to act on an obsession. An excellent book is Brain Lock by Dr. Jeffrey Schwartz. In this book, Dr. Schwartz explained his findings on studying OCD at UCLA and very effective way to heal your brain. The book offers great insight along with brain scans to help you understand how to treat OCD and what is causing you to do the things you do. No matter what book or article you read, try to find an understanding of OCD. The more you understand your OCD symptoms, the more control you have over your racing thoughts. OCD can be incredibly isolating. Looking at others who are seemingly normal can make you feel as though there is something wrong with you. But in reality, there is a chemical imbalance in your brain. So, finding an understanding of your disorder can be very comforting. When you can separate the symptoms and the overwhelming feeling that something will go wrong, you can prevent yourself from acting on an obsession. Number 3. Consider taking an SSRI. Another helpful way to treat OCD is to take an SSRI, which stands for Selective Serotonin Reuptake Inhibitors. SSRI are a type of pharmaceutical drug that helps to increase the level of serotonin in the brain. A lack of serotonin is a large contributor to OCD symptoms. With that being said, taking an SSRI can be an incredibly helpful way to treat OCD. Although many people still have symptoms of OCD despite taking medications, the symptoms typically become much more manageable. This brings a well-deserved sense of relief to the person suffering from this stressful disorder. There are many different SSRIs on the market, so be sure to consult your psychiatrist or doctor about which one is the best for you. Talking openly about your side effects and levels of anxiety on the drug you are taking will help you to find the right one for you. If it is taking longer than expected to find the right medication for you, don't lose hope. It can take a few trials to find the best SSRI for you and your symptoms, but it will be worth it in the long run. Number 4. Get help from a licensed counselor. One of the best things you can do when struggling with OCD is to seek the help of a licensed counselor. Very effective treatment for OCD is cognitive behavioral therapy, CBT. Another term for CBT is talk therapy, in which the patient talks with their counselor about their symptoms. Through these therapy sessions, the patient and counselor will find healthy ways to cope with OCD symptoms. A counselor can help you learn how to treat your OCD effectively when you're going about your daily routine. So, it is highly recommended you find a counselor who can help you take on the battle of OCD. If you're having difficulty finding a counselor near your home who specializes in OCD, online counseling can be a great solution. For online counseling, BetterHelp is an amazing resource. BetterHelp has hundreds of licensed counselors who specialize in OCD and other anxiety disorders. They can help you seek healing from OCD and can help you understand your symptoms.
Individuals suffering from OCD can undergo two types of treatment. Number 1, medication, such as selective serotonin reuptake inhibitors, and second one is therapy. One of the most common form therapy for treating OCD is cognitive behavior therapy or CBT. CBT is a short-term goal-oriented psychotherapy that is used to teach individuals of how their thought, feeling, and behavior work in tandem, and develop personal coping skills that can be used to change negative pattern of thinking and behavior. The C stands for cognitive, which refers to the fact that people have thought and interpretation and image in their mind in certain situations. It's how you think about things and perceive situations that dictate the kind of emotions that will follow. In anxiety disorders such as OCD, emotions are one of anxiety and distress that are mediated by the kind of thought that people have. In the case of OCD, the thoughts are obsession, which are cognition that we need to work on in CBT. The second one is B. The B stands for behavior, and the therapy focuses on changing aspects of behavior that are dysfunctional and or maintaining the anxiety state. The therapy comes up with the point of view that the way we think about things and the way we behavior of them will dictate the anxiety that we will feel in those scenarios. Anxiety is maintained by the kind of distorted thinking that the patient has. So, if you break the cycle of this distorted thinking and behavior, we can get a breakthrough in the level of anxiety. Then the person will start to realize that they can enter a situation that once made them feel anxious in the past and stay in the situation thinking more rationally. However, CBT is not for everyone. Individuals have to be very motivated to change, but it is a hard work and causes a lot of distress. In this therapy, you have to feel more distressed before you start feeling less anxious. Not everyone's ready to do something difficult, and not everyone has the time. It also can work for patients with too severe in the presentation of OCD, as their anxiety will get in the way of agreeing with what they need to do. They find that they are arguing and bargaining with almost everything they've asked to do and are too anxious to complete the homework. Those people are candidates for medication, which would turn down the anxiety level so they could engage at the therapy. The advantage of CBT is that it really works well. There's a great improvement in so many people who are motivated and do the homework of CBT, and it really does work well in people who are ready to make the commitment.